I'm Haley Wood. I'm a women's health nurse practitioner and founder of The Look. I have 18 years of experience in aesthetics. I have 8 years in plastic surgery. But before all of that, I worked in trauma ICU. It has allowed me to bring in a wealth of knowledge to the practice, not only for our patients, but for those other providers that we bring in to mentor them and coach them into providing the best services in Williamson County. My favorite procedure at the Look is lip filler. It's pretty simple, but if you're talking about a one-hit wonder and a one syringe wonder, one syringe always does so well in the lips and they walk out and see a transformation. It's so satisfying and patients are so happy with it. So it's pretty simple. It's lip filler. What to expect after filler treatment? The main thing is not to put any makeup on after you have your treatment because all those little punctures are just pathways for bacteria. We want to keep it super clean today. So for example, if you've had jawline done today or you plan on having jawline, keep your cell phone off your jawline because it's filled with bacteria. So we will do a great job of prepping your skin and actually even putting a little bit of ointment on those little puncture sites after treatment. You just want to keep hands off. Now tomorrow, after the treatment, if you have a little bruising and swelling, that's completely expected, and you can keep ice on those areas, but try not to put any makeup on the day of. The next day, you can apply all your concealer, your makeup, all that's totally fine. Now you may ask about your skincare routine. Absolutely. The night of or after your procedure, do all your skincare routine like you normally would. But just be mindful of not putting sponges and brushes and on your face and your hands on your face after your procedure. Keep it all clean. At 46, it's a little bit harder to maintain than it was at 26. So what does my whole year entail when I talk about my anti-aging routine? Well, I do my morning and night skincare routine. Amy has me on Triluma, which is a retin-A, a hydroquinone, and a steroid. And that's my retin-A, my vitamin A with my skin lightening, but it has a steroid combined with that so I don't have all that extra peeling and redness because my skin gets really red. But the best thing that I did last year, Amy did a Moxie 3-step peel on me. And so we do a Moxie treatment and then she immediately follows it up with a 3-step peel. So you got some downtime with that one. You've got a lot of peeling, you have some redness, and it's about 7 days of like full-fledged peeling. But afterwards, I've used my Triluma and I've had the best success with my skin. So on top of the Moxie and the 3-step peel, I usually do my toxins twice a year because I do Daxxify. So I'm actually able to get my toxins done about every 6 months or so. And with filler, I try to keep it at like 2 to 3 syringes per year because I don't want to be overdone. As an injector, what I don't want to see is a new patient come in and they look at me and they say, if you're overfilled and if you look overfilled, are you going to make me look that way? So I always want to be on the underside of volume and fill. I never want my lips to be too full. I'll never forget a patient who said to me, your lips are too big. And that was one of those defining moments in my practice where I'm like, patients are looking at you. They want to see what your ideal of beauty is. So 2 to 3 syringes of filler a year and then toxins twice a year.